Michael, have you, do you have the video blocked or anything?
No, you should be able to.
Because you cannot start video because the host has stopped it.
Oh, let me change that.
And let's bring up the agenda. This agenda.
Hey, Frank,
Yes.
what's happening?
Ah, I'm shuffling off to Danvers.
Right on, man. Are we starting, or I'm sorry, I just jumped in late.
We don't have
that's
cameras, but I
Video
don't
should
think
be
we
good
started
now.
without video. Oh, really?
My camera, I just have to turn my camera on.
Okay. There we go.
all right. Yep. Now it's good. Okay. It was
So
blocked there for a minute.
Is tomorrow your last day, Frank?
Yes, it is. Yeah.
Wow.
It was a very difficult decision, believe me, but again, I live in Beverly, so it's a 2.5 mile commute. Pay is a little bit more, but I have nothing negative to say about being here for the past 6 years, but it's just an opportunity that, you know, they called me actually and asked me if I was interested. So
Yeah, good for you.
you know,
Wow, that's good. It's good ego boost too.
yeah, we have. I guess the reason why they got my name is I don't know if you guys know Dennis Palazzo.
Yes,
Robin, you might know him.
yes, I
He's,
do.
he's an inspector there since he retired from the post office, doing inspections in Danvers. So I guess he must have given them my name. And believe it or not, he got hired as the health director for the town of Hamilton. And he doesn't even have any health background. He's a postman.
Really hope that doesn't happen to us. But
No,
we
no,
have a postman replace.
yeah, I guess they can't post it until I officially leave my last day, because, and I don't know if it's just a union thing. It was the same thing with Patty when she had retired. We couldn't post it until she actually, you know, left on her last day. But there are some candidates out there too. Actually, the prior person from Danvers, he's a little bit younger than me, but he knows public health very well. He's really brilliant. So I know that they have his application. And I think the mayor said that there were others that they're kind of vetting out as well. So I don't think it's going to be a long turnaround to get someone in here. Plus, you know, Joe Tabby, he made himself available. Well, I can just discuss that after anyways, and I offered my services too, so to stay on for anything.
Okay, going to get started with the regular meeting. And when this is finished, as you know, we'll move into executive session. So we'll start off with the approval of the minutes from the last meeting.
Motion to approve minutes.
All in favor? Okay, all in favor.
Aye.
Okay, now we'll have a COVID-19 update.
Okay, obviously lots going on. Although we're not doing it, we haven't done any vaccination clinics. West Newbury did have was running the Monday clinics last month and this past month, and I believe they're not doing it anymore. However, the big push right now seems to be with testing. But prior to me getting on that, I just want to relate some numbers. Latest numbers from the website. Newburyport positivity, 14-day positivity from time period, January 2nd to the 15th. we're at 16.19 positivity. And see, maybe I should share the screen. Let me share this. Where are we? Oh, right here. Okay, Newburyport right here, we're at 16.19. These are the surrounding communities in Essex.
Mhm.
See, all of Mass is at 20.61. Well, that's a far cry from 2% when we were pre-vaccine. As you can see, Amesbury is at 17. What else do we have here? Newbury's at 19. Newburyport 16. Salisbury a whopping 24%. Oh. And West Newbury's at 17. So
Those are just confirmed vaccinate, the confirmed, like PCR tested, reported.
Oh. Correct. Yeah. For some reason, I don't know why the state doesn't include the probables, which is, you know, the rapid test or whatever, because it is a positive case, but in terms of counts and numbers, they don't include that.
Do we have the number of hospitalizations? I see that on the left there. Do we know what going on at Jake's, how full they are?
I'm not sure if it's going to give you by
Oh, geez.
unit. You know where we can find that, Sam, is the weekly weekly data report off of this right here. We go back.
Yeah.
Interactive dashboard, COVID.
Weekly public health report on the bottom.
Weekly public health report. This might be it right here. Let's see. I guess not. June was the last one here. Wow.
Has anybody
Oh.
heard about this? Has anybody heard about like this discussion about changing the hospital reporting to people admitted with COVID versus people admitted for COVID? And that was coming out this week. And have you all heard about that?
Yes.
Have you seen it anywhere? Where is that data?
I have not seen it. I have not heard about it, but I know the last time we spoke to Anna Jakes, and Michael, were you in on that call too? Didn't they say that they are filling up, or they don't have that the much? They're nearing capacity at this point.
Well, I know they did hit capacity at one point. I don't know if that's gone down or what, but that was the newspaper reported
Yeah.
that like the week or two after our last meeting.
That
And I
was
did
last
see-
week.
I think the Boston Globe had posted something today about in regards to the number of cases that came in with COVID versus who.
Incidental testing with COVID.
Yeah.
Okay.
I think I saw on the news tonight that they had a breakdown of those who were admitted with COVID and those that were admitted for other medical reasons.
Yeah, I just figured that would be on the mass.gov website somewhere.
Yeah,
The
it looked
reason-
like that public health report. They stated that they stopped publishing that in June. So I haven't seen any other data from the hospitals, unfortunately.
Hopefully someone will be in the room from the hospital to give us a report. I only ask because a colleague of mine had a heart issue, went into Anna Jakes and was kept overnight, but was kept overnight in the ER because they told him there are no rooms for you. Everything is full with COVID. And like, you know, you can imagine trying to sleep in an ER. So that was very alarming, and that was last week. So I just want to make sure that they're not.
Yeah, I can find out. Again, I'm back in tomorrow, but I'll give a call down there and see what their status is, because they're pretty good at letting us know. Because we did used to have at least a monthly call with them, with Energies, to give us an update. But obviously we haven't done that in a little bit now. So, but I can get that information and just email you on that. Okay, so those are the numbers. I don't have the agenda in front of me. Is testing on the agenda?
Yes,
Okay.
actually, it's the next item.
Oh, okay, so we can kind of segue into that. So again, our numbers are climbing. The month to date, I'll bring that up at least. And I didn't update it as of yesterday, but maybe COVID. Here we go. Okay, I'm going to share screen. Okay, and Sam, I know you asked for a trend, and I don't know if there's something else you're looking for. This graph right here is the 3-year comparison. So in 2020 is the blue here. So we said January, February, obviously we started with 0. So here's that trend there. And then what we just ended 2021. So you can see that from the pattern is like come November, December, it rises up. And then the following year in January here it starts to decline. Spikes until we get to the summer. So this graph here, the red, you can see we're already up to 440 cases. So we're starting way up here.
That looks pretty amazing. I'm really interested in what that red line does and how closely it follows the yellow line.
Yeah, we're only, well, this is day 20, so this was updated, as you can see here. I think it's only from 2 days ago, actually. So December 20, January. So yeah, last I, so this doesn't include the 18th or the 19th, past 2 days. But again, already we're at 440 cases. That's huge. So the 328 is the confirmed and the 112 is the probable. And you can see on the monthly one just how, I mean, here we have 99 in 1 day, which was on the 4th. So now we're averaging upwards to 20s, 30s, 90s. You know, you see 50, 58 here. We are seeing that they're coming back to the nursing homes and long-term care facilities. We did have some at the daycare centers. What was one of them? Kinder care was one. And believe it or not, I actually got calls from the parents, because what Kinder care did is they basically just shut down their services. And I got calls from angry parents saying that it's causing a burden on them by closing, even though they're having positive cases. So they're closing so it doesn't spread, but the parents don't want to hear that. So they wanted me to get involved, and I told them I can't. I said, it's private. I said, I can't order them to stay open. If they choose to close, I mean, so be it, because they don't want, you know, their staff getting infected either. So that's where the majority of them are. In terms of the school, they're doing that test and stay, but that protocol is only if the positive case is through the school as opposed to outside of school. So if it happens at home or during one of the sports, then they can't do the test and stay. And that's one of the things that the parents wanted me to tell kindergarten to go onto that program, but they can't because that's strictly a school program. But as of yesterday or today, DESI came out with new guidelines. And Michael, are you more familiar with the DESI guidelines, seeing that you're doing all these testing with Pam? Are you familiar with it?
Not so much DESI as the early childhood. I know DESI is now switching. They're saying you don't need to contact trace and no longer do the test and stay program, but here's an at-home test kit, you test before coming in.
Exactly, and they're giving them the option that if they do, if the school district does accept the test kits from the state, then they don't have to do the test and stay. But you can't do both either. It's one or the other. Either accept the test kits from the state, or they can continue with their test and stay program. So that's all I have there. And again, back to the front sheet. 1 year to date, again, it doesn't look good right now. Okay, again, I don't have the, what's next on the, oh, here it is, agenda, sorry. COVID testing. Okay, indoor mask. Unless there's any-
Mask mandate is the next item.
Okay, so COVID testing, what we did is we purchased a pallet of home test kits at the tune of, what was it, $75,000. $10 per kit, and each kit contains two tests in it. And what we did is we did have a drive-through event this past Saturday when it was 3 degrees out there. But we actually gave out, what was the final number, Michael? It was over 3,500, right?
Yeah, it was closer to 4,000.
Wow. 4,000 boxes, i.e. 8,000 tests.
Correct, yes.
Wow.
Yeah.
In Newburyport.
In Newbury, yes. We had a maximum of five kits per household. So they had to show proof of residency. We did have a couple from outside of Newburyport that tried to come in, and I had to be the bad guy and escort them out. So it was a very good turnout. We got positive feedback. And Michael, if you could just go over where we gave out the others, because I know you and Pam gave some out already, and we still need to give more out. So if you can inform the board who received them.
Yeah, so we had a couple of buckets. Our first one that we did was housing. So we gave 450 kits to the Newburyport Housing Authority, and they were working with not only their buildings like the Sullivan Building, is it Keller Way and Horton Terrace, but also with group homes and nonprofit partners that they have. We gave 180 kits to the James Steam Mill and 180 kits to the Heritage House. The next bucket that we had were the seniors. We ended up giving them, I think the total came out to 800 or 900 kits to the senior center, who was distributing them through their programs like Meals on Wheels and their services that they provide. The 4,000 that went to the community, and then we're still working on getting kits out to the city staff. So we've done the schools, City Hall, DPW. I think the only two left on our list right now are police and fire, who haven't gotten their allotment, but we're going to get those to them this week.
And in addition to the take-home kits, we still do testing here when needed, especially for staff, because we've had a few at DPS that have tested that have come down with it. So in order for them to return, we offer the service of testing them here. So Michael or Pam would do that duty there if they have trouble getting tested at their local CVS or whatnot. So we still provide that service here.
And one group I left out of the at-home kits was we actually also gave, it was either 40 or 50 kits to the new Afghan families that we welcomed to Newburyport through the churches that are housing them.
Oh, wow. How many do we have, Michael, there? Do you know?
How many families?
Yeah.
I think there were 3 families total.
I thought there was one. That's amazing. I thought there was that one family of 9 St. Paul's. I didn't know there were more.
I think there's a second family at St. Paul's, and then there's one I think is at the Unitarian Church right here in downtown.
But if they need a Farsi translator, just let me know.
All right. Testing, went through vaccines, went through numbers. I don't know if I'm missing anything, Michael. Am I missing anything? I think that was about it for the testing.
Yeah, the only other testing thing was we did testing clinics at the Harbor Master the past 2 weeks. We just finished up our last one tonight. So in total, I think we did like probably 300 or 400 tests there over the past 2 weeks.
And that was for the general public, right? Did that also include the city staff?
That was
Or-
general public.
City staff, basically they'll come in like assigned time in the morning, usually. So I know we've done a number of them, so. Okay. All right, that's all I have to say for COVID testing and COVID.
Well, then the next item is going to be the indoor mask mandate.
Hey, Frank, do you mind stop sharing? That's just a pet peeve of mine, sorry.
No problem.
Okay.
I just wanted to see the agenda.
One of my Zoom pet peeves, I'm sorry.
Oh, my bad. As I'm clicking away too. If I may add before the board discusses the mask mandate, just to let you know, we got a call from the tennis club there and asking if they don't have to wear masks while playing tennis. And in addition, I did get a call from the Performing Arts Center here, asking if the actors needed to wear masks while they're acting. So I'll leave that to the board for discussion and let me know what you want me to do. And please remember that during the pandemic, when they did have the sports guidance, tennis was considered a low risk sport because it's people with distance and whatnot, and they did not have to mask up for that activity. And with the performing arts, there was a that guidance called for a certain distance between the actors and the audience, which was like 20 feet or something, which I believe they have that. So I'll just give you that bit of information as well.
The actors need to wear them because Broadway has been spreading even amongst their rehearsals when they're trying to reopen between the cast members really rapidly. And those were some of the first notable outbreaks in New York in 2020. People died. Like Moulin Rouge shut down first, and some of them for months were still suffering and in hospitals. I mean, they spit a lot when they act, especially. They're going through lines, and it's not about the audience so much, it's between themselves. It's the same thing as an office, but it's worse than an office because they're, it's clustered together. So Yeah, while they're acting, they cannot. I don't know if you want to have a different rule, like if they're gonna act as far apart as tennis players, or like what
That's not
that's
gonna
about.
happen.
Or
Yeah,
they, or like the separate thing that casts do is they test and get in a bubble. I mean, the performances on Broadway are not in masks when they perform, but they're testing or should be testing every day. And I don't know what this performing arts centers. I test my staff every day, but I hoarded masks and all the equipment since November. I made a video. I try to tell everybody, if you don't have them, it's not my fault. But
mhm.
I don't know if this performing arts center has them.
Yeah, I'm not sure. Yeah, they didn't say that they had any testing protocol or anything. So, yeah, if you want me to say that they have to wear a mask, or obviously don't have any performances until, you know, the mask mandate is lifted, or, you know, numbers go down, I have no problem letting them know tomorrow.
A lot of performers wear that shield mask and perform in that, and that could be adequate. And but if they're not able to test with between each other, I mean, they run the risk of just getting the whole cast sick at once. So
Well, I think we should have them wear the mask while the mask mandate is in force. And as far as the tennis, since it's a low risk, then they don't have to wear masks. But that's just my humble opinion. Anybody else want to weigh in?
I don't know. I don't know. My kids go there. It's pretty crowded in there. It's not like
Well,
there's two people. It's not like there's two people like 30 feet away. It's like there's kids in classes in groups. I mean, if they're wearing it in school, you know, I don't know. I mean, what's more important? Like, you know, like we're doing all this work, or schools are doing all this work
Mhm.
to keep schools open and keep kids in school and keep people from getting infected in school. And then they go out and they're in a tennis class, 20 of them without masks on. That doesn't really make a lot of sense to me. I mean, it's
that
not
makes
that big of
sense.
a deal.
So is the
Okay.
consensus to keep the mandate as is for
Yeah, I
everyone?
mean, I wouldn't like, you know, I don't think we should like be micro sort of obsessing over, well, not this, you know, like this is not,
Yeah.
it's, you know, this is one thing that was interesting in Ireland. This is like not an issue. Like people just put on a mask when they go inside, and like they don't even talk about it. It's not even spoken of. It's just, they just do it because it's not that big of a deal. We're the only place that makes such a big deal out of this, you know? It's really crazy.
And like, I'm fine with that, because my opinion to the board is, if we do make one exception here, then we're gonna be getting calls about all these other sports as well. And if the schools are requiring them to wear the mask while they're playing, you know, sports, you know, I don't think it'd be a good idea to, again, stop, you know, picking what sports can and what sports can't. Just my opinion to the board.
Okay, then we'll just keep the indoor mask mandate in effect until it's not.
Under the same stipulation that we'll revisit it, the board will revisit it at the next meeting? Or,
This is the next meeting,
okay,
which, you know, comes to the mask mandate. When the numbers were going through the roof, I was thinking to myself that when it came up, at this meeting for whether we are going to extend it beyond the February 1st date, then I was of the opinion myself that we weren't going to rescind it because of the high numbers. But in the last few days, the numbers are coming down. And I will throw it out to the board, whether you want to extend the mask mandate beyond the February 1st or drop it.
When are the schools in place until?
Frank, you know?
It's the end of February.
Yeah, I don't know. I'm sorry. I can try to look it up right now.
Michael, you said the end of February?
I'm pretty sure it's the end of February.
Okay.
Yeah, I mean, I wasn't here last meeting, obviously. I mean, I probably would have voted for it. I think, I think lifting it, I think you put, it's in place. I think lifting it sends a wrong message, like, if the kids are wearing them in school, why can't we wear them in Market Basket? Like, what's the big deal? And, like, if our kids are wearing them all day in school, why can't we wear them?
I
Right?
think what to add to that, when we're looking at the numbers coming down, keep in mind that they're really, really high numbers to begin with. So if they come down a little, it's still really high. And even though it may be going downhill, there's probably going to be a really long tail. I am thinking when comparing it to the South Africa numbers, well, there's two things. I want to look at what the numbers are in the hospital, but we already talked about that. And then you can't really go by these numbers too much. As we said, I don't think everyone's getting tested with PCR and going. Like, a lot of people, especially if they don't feel too concerned about it, will just test and stay home. I've screened out some of my employees. I don't think that they reported it in any way. I just wouldn't let them back until they tested negative or were, at 2 weeks or whatever. So I don't think we're in a place anymore where we can trust those numbers, although they're like a good proxy indicator, which is why they're going back to the sewage testing. And the big news was that the Boston viral load in parts per million, the sewage system had dropped steeply. And then that was an indicator that we have a similar sort of like steep drop, like the South Africa numbers went down. Okay, and then if we're comparing to South Africa, it's summer in South Africa, so there's that. So I don't think it's completely analogous, whatever happens there. And even there in South Africa, they have a long tail, so it went up and down steeply, but it's sort of like lingering. So then the question you have to ask is, how thick is that tail going to be? Because if it's already such a high number to begin with, going down isn't really that impressive, because, like, you're eventually going to run out of people to infect at that rate. But then how many people are still being infected, or, and then my other concern is that's one number to look at, like how many people still are getting infected or how many people are getting sick, but like what's going on at the hospital? Because if it's still full, then I don't feel comfortable at all lifting it. And so I guess I don't have all the information I would want right now to make a decision. And I don't think right now I would say February 1st, I'm just comfortable with lifting it. It's still like smack in our winter, and there's a lot of indoor activity, really cold.
And it's the least disruptive, least invasive, cheapest, safest mitigation tool, right? I mean, I agree. Like, I think the schools are, I think this, you could just sort of use the school as the guide, right? Like, yeah, less sort of centralized testing, more at-home testing, less contact tracing, decreased isolation times, like getting out, like, people are always talking about living with the virus. Like, that's living with the virus, like living your life, but also putting on a mask to try to blunt the transmission a little bit so that, our hospital colleagues don't like have nervous breakdowns, so that you can get care when you have a heart problem, so that, vulnerable people that need to go grocery shopping can be protected. I think there's like no question about, in my mind,
I would add, like, if the businesses want to still stay open and everyone has the whole world is short staffed right now, they can't afford the little staff they have be sick or be out sick. And so, like, people entering without a mask is a fear. Businesses fear the little staff they have getting sick. So, I mean, I think they expressed that a little bit at the last meeting, and I think they said like they wanted to remain anonymous also. So if I just want to relay some of that information, and if anyone out there has a different opinion, like, I'd hear it. But maybe I agree. I'm comfortable with extending it to what the schools have, because that's end of February. February's not a very long month, and it's still gonna be cold. So,
And we'll review it at the February meeting, which is going to be February 17th. So at that point, we can decide whether we're gonna just let it run out at the end of February, or we're gonna have to extend it.
okay. So for now, we're extending it to February 17th.
No.
Okay.
Yeah, February 17th. Which is our, no, why don't we do this? Extend it to February 28th. And when we meet on the 17th, we can decide whether we're going to continue it beyond the 28th or end it on the 28th.
Okay. Do we have to motion that and vote?
I believe you should, because you did say the last meeting that you were gonna, because we did have it in effect up until end of January, right? So if you extended it, you would have to vote.
Motion
so-
to extend mask mandate to February 28th, pending February 17th meeting.
That's
Second.
short and sweet. All in favor?
Aye.
Aye. Okay. Now, all we have left is general department update.
Okay, well, the news is, unfortunately, tomorrow will be my last day. And again, it was a tough decision to make, so I'll be going to Danvers. They have, from what I understand, gotten some applications. I know that Joe Tabby had made himself available for interim, and he did speak to the mayor. He bumped into him today, actually. They had something from myself. Oh, and Donna M is leaving too, from the mayor's office. They hired a new person, and she started today by the name of Christine. So with that said, and I offered my services too, to work either remotely. And Pam and Michael do have my number, so if anything comes up, they can always give me a call. I am going to be keeping the same number. I spoke to our phone person here. So there may be maybe one day of interruption just to change to my service provider, but I'll be keeping the same number, same cell number. So I'll have you guys, everyone still in my contacts. And Michael, I know that you have been involved with discussions, but I'm not sure if that's anything's going to be said in executive session. But that's all I have for an update for the health department. Nothing outstanding. I'm tying everything together. Oh, just to let you know, in terms of an update, the Thirsty Whale is going to be reopening. 2 people bought that, and I believe that's going to be probably within a week or 2. They're trying to get their common victuals license and their liquor license straightened away. The other new place that's opening up within a couple of weeks is called New Kitchen. That's NU. It's the old Chinese restaurant there on Pleasant Street. And a New Kitchen, I asked what is new NU, and they told me that's French for naked, meaning that they're serving like fresh, healthy foods. That's their concept. They're going to be doing a lot of smoothies and salads and things like that.
I can't imagine the venue being as large as it is.
It's huge, Robin.
I know.
Huge.
I'm going to have to sell a lot of smoothies.
Yeah. And they're also going to have, grilled things, but not like hamburgers and things like that, things that are heavy. He's going light and healthy. Another place that we just did a walkthrough is another smoothie place. Actually, is going to be coming in at Port Plaza. It's was a pet shop right next to the fitness center, and they're going to be focusing on like those powdered protein drinks. Nothing really like with fresh fruits and vegetables. So they want to target like the Planet Fitness there and those type of places. So that's in the initial stages, because they just rented the place out, so they have to convert it into a working restaurant. Let's see, what else we have? Oh, and lastly, we are applying for a grant, $300,000 grant. And it's good for up to 3 years, and then it can be renewed for another 3 years, and then again renewed for another 3 years, for a total of 9 years. And originally we applied to do contact tracing and COVID work, but the state got back to me and said that this grant is to enhance public health, so any services that we may need. So we teamed, and they like the regional approach, so I teamed up with Salisbury, Jack Morrison Salisbury, Deb Rogers in Newbury, Frank in Raleigh, and again, us in Newburyport. So what we're doing is applying to get more help in terms of getting inspections done, because one of our inspectors, Rob and Kristen, because of COVID, she just does not have the time to do inspections. So we're down to one. So we're going to do shared services for inspections and also for nursing services. In addition to that, they did offer a $52,000 grant for 1 year. And we can use that for COVID related. So we'll still most likely use that for contact tracing. At this point, contact tracing, the state is basically saying, if you can do it, do it. If you can't, just pick your priorities. So it seems like they're getting away from that, or they already did, but they're not giving us any support or saying that we have to even do contact tracing at this point. But we're doing the best we can here with what we have. The schools are still doing more or less doing their own, but we keep an eye on the Maven, and we'll we'll contact trace those kids that are at the school age, or if we see that there are anybody from the nursing homes and things like that, long-term care, we'll focus on that as well. And we have a pretty good communication with these long-term cares. If they do have positive cases, they'll reach out to us and let us know. They go into immediate lockdown, and then they have state protocols that they have to adhere to as well. So, I mean, we have had positives there, but not to the extent that it's widespread throughout the facility. So, and the minute they do that, then they also go into daily monitoring and weekly testing as well. That's why we've had so many tests being given as well. And Michael, since I'm going to be passing the torch to you, Michael's working with our grant writer, Nancy. So is there anything that I'm missing on that piece regarding the big grant?
No, we'll hopefully apply for it or get the application back in on end of day Monday. We rewrote the narrative, rewrote the budget, and we just got all of our letters of support from each of the communities. That should be in. So hopefully we'll have an answer or have a response from the state by early February.
They gave us what they call a conditional approval, meaning that we got the grant. We just have to rewrite the narrative. And I got that from actually, he was a colleague of mine. He was a health director in Framingham, and he went to the dark side and took a director's position for DPH. So he's the one who contacted me, and he vouched for us to because they weren't going to accept it because it was just related to COVID. So when he told me what the new guidance is, so he gave us a chance to resubmit, but conditionally he said we have it, but we just have to resubmit.
I got a grant idea if anyone's interested.
Sure.
Like we need some sort of we need like a local kind of like I'm envisioning sort of like a trolley, right? Like something to take all those kids from like on the other side of 95, and sort of a trolley that would go sort of into town, downtown. It would go past the schools. It could drop them off at the Y. Like it would be this circuit, Newburyport Youth Services, wherever that ends up. But you know, if you had like a trolley that, you know, circled around like whatever that is, Ward 5 over by Turkey Hill, and came down Low Street past the schools, went to the Y so kids could get from school to swim lessons, right? Swimming, kids need to learn how to swim. Downtown Newburyport Youth Services, they could, you know, you put your bike in front, sort of circles around every hour. Wouldn't that be awesome?
A monorail. We should build a monorail.
Yeah. I mean, we have
A van or like a trolley? You mean a van?
Yeah, I mean,
Like
it's like you know, it could double as like a touristy thing, right? Like in the summertime, like tourists would hop on it. But
Like
there's
a monorail.
there's these kids over in Turkey Hill, and they can't get downtown safely. They can't get to activities safely. You know, swimming is not just exercise. Swimming's a life skill. And a lot of kids don't do swimming lessons, not because they don't have the money or they can't sign up. It's their parents are at work and they don't have transportation to get, you know, to swim lessons, to home, to school, right? So that kind of thing.
Gotcha. I can have a discussion.
Mayor's in, I like it.
I have a discussion with Andrea on that from Youth Services. And maybe even partner up, you know, see if the vans are available at the senior center. You know? But I can get some info on that.
Okay. Unless there are other matters.
The mayor signed in and left a message regards to what Rob said. I'm in. This was discussed a lot during the campaign, especially in wards 5, 6, and Plum Island. So,
Oh,
So
okay.
we can move forward with this then. You want to take the lead on it, Rob? You're muted.
You mean like sort of like writing something up or like making a proposal, or what do you mean? Did you freeze? Did I freeze?
No,
Sorry, I was responding to the mayor, so I didn't hear what you said.
does the mayor want to chime in?
He posted something in the chat that Sam had read.
Okay, why don't you come up with a proposal?
Of course, I made a chat comment because I didn't think I'd have to come on here and talk. I do think it's a great idea though, and it was talked about a lot. So I mean, again, this is something that we, Dr. Slocum mentioned like looking for a grant. I mean, that's something we can have, Nancy, our grants developer here for the city, be on the lookout for. But I do think it's needed, and I just think like you said, there's so many neighborhoods that are disconnected in the city. Even if it was just a seasonal bus, I think it would just get bus or trolley would get a lot of use and would really connect to different parts of the city. So yeah, no, I think it's worth looking into for sure.
Right on.
Okay, so we'll let Nancy go forward with this.
Yeah, let me talk to Nancy about it. We meet pretty much daily, so I will bring this up to her and see, have her maybe take a look around and see what's out there.
Okay.
Thanks.
So the next meeting is going to be on February 17th. Is Joe Tabby going to be sitting in on this meeting? Frank? Mike?
I
I'm
don't
not
believe.
sure.
Yeah, I don't believe so. Not as of right now.
Okay, then it's just going to be the three of us with an agenda provided by Michael. That sound realistic? And when we find out from HR about the list of candidates, then we can set up a time and place, well, it'll be virtual, for interviews. And it would be nice if it was pared down to 2, 3, maybe even 4 candidates. And I think that we should let HR review them and see if they meet the criteria of what we have set up that an individual needs to be and have to proceed with that individual. Any other comments? Okay, then I think we should move on to the executive session, which means we leave this one and chime in on the other Zoom link that Michael sent us.
Can we just for the minutes, thank you to Frank for his service to the city, especially during a pretty tumultuous time. He did a great job. Really led the way with getting those first responders vaccines out, like ahead of a lot of communities, and did a great job. And it's been a pleasure to work with you.
I second that. I think you and Patty, like, you shouldn't have left without like an award or a wreath or something. Like it was a lot of work. I mean, it was a lot of weekends and work, and you were working like entire weeks at a time, and our community benefited from that. So deeply thankful for all the work you did.
And since I've been on the board the longest, and I've dealt with, I lost count of how many health directors. Frank, I believe you were the longest sitting one and the best one that I've been through. And thank you for everything.
Thank you. You're giving me a weepy-eyed here, but vice versa, seriously, I have nothing negative to say about the city. And again, the new Mayor Reardon, heard nothing but the best from you, and I wish I had the opportunity to stay. But in reference to the board, I have to say that this is the most qualified board that I've ever worked for. And in knowing the boards in Beverly and Saugus and even Danvers, so thank you, for support and the guidance too, and what we do day to day. So I do say thank you.
Okay,
We'll miss you.
yes. On that note, should we move on to the next Zoom meeting?
Motion to adjourn?
Second.
Let's adjourn, gentlemen.
All right.